So how did the group start? Well, on the 27th of May, I just happened to see frontline headline in the Examiner about the fact that the Cork Harbour community is not going to get a baseline health study. And it kind of rang a few bells with me, and I thought, sure we were promised that, or something like that in 2008. So I went away and I read a little bit about the article and did a very small bit of research on the internet. And I got extremely angry, so I thought, well, what can I do about this? I'm going to set up an online petition. So I did that, and then I thought, okay, this is fine, but how do I let people know that there's an online petition? Well, I'll set up a Facebook group. So I set up a Facebook group. And then, all of a sudden, this Facebook group kind of grew legs and arms and more members. And then there was a county council meeting, and somebody mentioned the fact that this housewife in Cobh had started this petition in this Facebook group, and has a harbour baby. I don't know if any of you in the room have ever heard the reference, a harbour baby. But children that are born with medical issues in our harbour communities usually end up being transferred up to the likes of Crumlin, like my daughter was 16 months ago, or up to Temple Street in Dublin. And I was up there with my daughter, and one of the nurses who was doing her MRI scan said, oh, it's another harbour baby. And at the time I thought, and I didn't question it. And it's only just recently that I thought, gosh, you know, she's actually right. And I'm meeting a huge amount of people in our community who have these wonderful, beautiful children who are really poorly and are also being classed as harbour babies. This was brought up in a county council meeting by one of the members about this woman with a harbour baby, and the press picked up on this, and before I knew it, my phone was hopping with interviews and photographers coming down to take pictures, and all of a sudden I was swept from starting an online petition to starting a pressure group. And I'm really pleased I have, and I really hope that this pressure group can represent all of you. So, a bit about the history of our harbour as I know it, and please bear in mind that I'm just a housewife, and I'm very well supported by a team of experts that you can fire complicated questions at. In May 1991, the Minister for Health wrote a letter to Carrigaline Environmental Group advising appropriate arrangements are being made to carry out an epidemiology. Okay, saying it's not possible any longer, anyone to have a look at them. July 2008, John Gormley said that he would recommend to the Cabinet a full baseline health study in our harbour area after an estimated 500,000 tonnes of waste was found on the island's east tip. So we know there's waste there, yes? They know there's waste there, and they're saying, okay, there's waste there. So nobody's actually saying, no, there's not, which is good. This is good for our campaign. And then, 27th of May, the government has refused to carry out a baseline health study in Cork Harbour despite the discovery of a toxic waste dump adjacent to a town that has a 44% higher cancer rate than the national average. I believe this cancer rate is now 37%. I don't care whether it's 37%, 44%, 20%. We are still higher than the national average. And to me, when you're higher than the national average, it needs to be looked into. I hope you're all in agreement with me on that. So let's have a look now as the reasons why the government is saying, oh no, this time around actually you don't need your baseline health study. Well, according to Minister Gormley, the air monitoring results at the site and in Cobh showed no risk to people. I have some of the documentation up on the board as well from the White Young Green report. There was 1 month in April 2008, which just happened to be one of the months early on in my pregnancy, and it always makes you think, where the air quality testing and all these testings that they did was way above the limits that were acceptable. The reasons for this, apparently, is that the air monitoring results only showed exceedingly high results at a time of exceptionally dry conditions and strong winds. So let's do months and months and months of air quality testing on very dry, very wet, very calm days. Because there's not going to be a huge amount of dust kicked up, is there? But when it's windy and when it's dry, there's obviously a problem. They also reported that there were large stockpiles of unauthorised excavated material from the east tip being stored upwind awaiting transportation. So in this sentence, they're proving A, there's unauthorised stuff going on over there, and B, that any material that is excavated and just dumped there is prone to being blown by the wind. So when we look out of our windows, or we're down the town, and we look across to Hall Bowling, and it's a dry but windy day, it's all still there. It's all exposed. It's not been covered up. It's not been removed. So surely it's been a risk to us. To me, as a layperson and a housewife, that's how I view it. In July 2009, Minister Gormley had asked the Office of Public Works to form a working group, and people thought, okay, this working group, they're going to be looking into Hall Bowling and what's best to do with Hall Bowling. And then, shortly after I started the group, there was an article in the Examiner saying that the working group will not be examining the toxic waste dump on Hall Bowling. The group's remit did not include matters relating to contamination, remediation or containment measures. Okay, so I'm thinking this is interesting. We're going to pay some people, probably quite a bit of money, to go and look at Hall Bowling, but they're not actually going to look at the issue with Hall Bowling. So what are they going to look at? The group will be looking into consulting with the Department of Defence and the Defence Forces on the naval services, future requirements and security issues. Great, brilliant. I think the Navy guys, I think anyone in the Defence Forces are amazing people. Great, talk to them about it. Let's make sure that they have all their security issues sorted. Reporting on technical constraints, zoning issues and regulatory requirements of the site. As a layperson, not entirely sure what that means, but I know damn well it doesn't mean looking at the contamination issues. And they're going to be asked to come up with a comprehensive list of possible future uses for the site. This will involve local consultation. So ladies and gentlemen, let me ask you now, what would you like to see when you look out from our high street, from our beautiful prom? What would you like to see over there? I was thinking a nice big statue, or I don't know, a big tree or something like that. Actually, come and consult with me, because I'm a local. I say, clean it up and make it safe. So the group's objectives. Long term, we want an independent baseline health study carried out in Cork Harbour. We can speculate till the cows come home that our medical issues in this town are linked to Hall Bowling. But there are other harbour communities that aren't so affected by Hall Bowling. What's causing their medical issues, like the huge rates of cleft palate and things like that? So we want our independent baseline health study. In the short term, we want Hall Bowling cleaned up and made safe. Nobody in this group is going to tell anybody how it should be done. That's down to the experts, the engineers, to come up with plans, put it to the people, and let's discuss it. But let's do it properly. What we'd also like to do is we'd like to be able to carry out our own independent water, soil and air testing. As a group, we feel that we can read all the reports that we want to, but if they've been commissioned by the government, can we really trust them? The government have told us twice in the past that they're going to do a baseline health study. Have we had our baseline health study? No. So can we really trust them? We would like to be able to do this independently, and that way we can report back to you about what's going on, what our findings are, and you can be reassured that they've not been, well, done on wet days when there's no wind. We would also like to be able to meet the people in our harbour communities, not just in Cobh but outside of Cobh, and gather information and listen to the issues that you're facing. We want to represent all of the community groups, and when we take our campaign further, which is hopefully sitting in front of the Minister of Health, we can represent all of you and know that we've got a strong group behind us. We want action, and we want it now, and I really hope that you believe in this group enough to support us.